Yeah, I'm really excited to introduce Dr. Lawrence Brass as our speaker for this hour. Dr. Lawrence Brass is an attending physician specializing in hematology at the Hospital of the University of Pennsylvania. He received his medical degree from Case Western Reserve University School of Medicine and is now the Associate Dean and Director of the Combined Degree and Physician Scholar Program at UPenn's Perelman School of Medicine. He's also the director of the Pharmacology Graduate Group, the Cell and Molecular Biology Graduate Group, and the Hematology Fellowship Training Grant at UPenn. He will also be joined by several MD-PhD students for a Q&A panel at the end. Please welcome Dr. Lawrence Brass and his 6 MD-PhD students as NPHC guest speakers. I'll hand it off to you now, Dr. Lawrence Brass.
Thank you, Saya. I appreciate the introduction. And all the extra jobs that you gave me at the University of Pennsylvania, fortunately, many of which I don't actually have. But one job that I do have that's particularly relevant for today is that I've been the director of Penn's MD-PhD program for a number of years. And so my goal for us for the next hour or so is, with the help of some of the current students in Penn's program, to really talk about MD-PhD training and what it means to be a physician scientist, how you go about applying if you decide to, and what we look for in the admissions committees, not only at Penn, but at other medical schools as well. We'll have a lot of time saved for questions and answers from those of you who signed up to join us. And if you have specific questions, feel free to fire away when the time comes. And if you have general questions, those are okay too. And we'll do our best to answer them. And I'll give you my email address at the end so you can contact me if you'd like to know more. So having said all of that, I'm going to share my screen and lean on a few slides to tell you at least the beginnings of the story we're going to have today. And after we do that, I'll allow the panelists to introduce themselves, and we'll let things go crazy from there. All right, now if I've done everything right, then you should see a slide that says becoming a physician scientist at the top. Could somebody kindly confirm that you're actually seeing that?
We can see it.
Great. Okay, so there's my name and contact information, and the folks in the middle of the slide who are smiling are not only a group of Penn MD-PhD students, but they all happen to be in the social sciences and doing PhDs in anthropology. I'll show you lots of pictures of others as well as we go along. All right, let's see, there we go. So a good place to begin is, what is a physician scientist? And this may be really helpful if you've heard of it, but you're not entirely sure. And even if you know what it is, maybe this will give you an additional perspective on it. So physician scientists like myself are people who are trained as both physicians and scientists, or investigators. And I sometimes use the word investigators, frankly, because of the fact that not everybody's a laboratory scientist. There are lots of people in MD-PhD training programs who are doing PhDs in many things, including not only the biological sciences, but also chemistry, and you'll meet one of those in just a little bit, and bioengineering, and you meet one of those in just a little bit, and the humanities. What we all have in common is that we all view being a physician scientist as a research job. And so in our careers, which vary a bit from person to person, the one thing that's in common is that most of us spend most of our professional time doing research and applying research, as well as taking care of patients. In fact, many of us also take care of patients. I do that on a regular basis. And we do research that is tied to human biology and disease in general, but often many of us will do studies and research at the basic and applied level that relate directly to the diseases that are present in our patients. And that's kind of exciting, because that's a true way to combine things from bench to bedside, which is what a lot of us take pride in being able to do. Many of us who have completed training in MD-PhD programs, as I have, eventually found their way to jobs that are in academia. But other graduates of MD-PhD programs work at places like the NIH, other research institutes, government agencies like the CDC and the FDA, and in the biotech and pharmaceutical industries. So there are lots of options of what you can do when you finish up an MD-PhD training program and all the postgraduate training that goes along with it. And I'll talk more about that in just a little bit. If I We're going to show you a pie chart, and here I am showing you my one pie chart, I think, for this talk. This is a pie chart that gives you a notion of where graduates of MD-PhD programs nationwide said that they were working when we surveyed them back in around 2015 or 16 or so, and then published in this report that I've listed on the lower right. You can actually look that up online and download it from the AAMC. And what we found is that about 2/3 of graduates from MD-PhD programs, after completing all of their postgraduate training, found their way to jobs in academia, jobs like the one that I have. And we'll talk more about that in just a moment. And then there are a bunch of people at the NIH and in federal agencies and so on. And what you can see is that there's a lot of variation in how thick the slices of the pie actually are. And that's because most people end up in academia, but not everybody does. About 1/3 of people end up in places other than that. Now, all of these outcomes, I think, in general, are just fine for MD-PhD training, but one that is less appropriate for the people who, after all the training and learning how to be physician scientists, decide to give up the research and go into private clinical practice. That's a wonderful career, but not one where you need to go to graduate school and become a physician scientist in order to prepare you for it. You get wonderful training by doing medical school to become a private practitioner. Bottom line is that, physician scientists, especially in academia, get to do lots of things. And so I've already said that it's a research-focused career, but we take care of patients on a regular basis, and we get to teach in medical school and in graduate school. They used to call this being a triple threat. I don't think there's anything especially threatening about it. I think it's really kind of exciting to be able to do all these things. And when people ask me, how do you manage to do all that and still, manage to sleep and eat and have a family and raise kids and so on? Well, the answer is that, we balance our contribution to all these various things, and that balance can differ over time. But the notion is not to have that absorb 110% of our waking hours, but really to allow us to have lives as well, which is very important. So quick FAQ for MD-PhD programs. If you started looking into MD-PhD programs, you probably discovered that there are about 150 medical schools in the United States at the moment. Not all of them offer MD-PhD training. The last time I counted, there were about 90 medical schools that had an MD-PhD program. However, it's worth pointing out that not all of them are really active in the sense of admitting one or more students each year. So you have to look under the immediate listing of whether they're an MD-PhD program and see just how actively recruiting physician scientist trainees there are. The size of MD-PhD programs varies enormously around the United States. They range all the way from somewhat less than 30, although that's pretty much the lower limit for an active program, to really big programs like the program at Penn and the program at WashU in St. Louis, where we have well over 200 students in the program. Now, that's not 200 MD-PhD students entering per year, but 200 students total, throughout the length of the program, which averages about 8 years. Of the 80 or 90 schools that have MD-PhD programs, 54, the last time I checked, are supported by NIH, NIGMS training grants and known as medical scientist training programs, or MSTPs. And you'll encounter that term a lot once you start looking into MD-PhD programs. So MD-PhD programs that have these grants have been vetted by close inspection by reviewers at the NIH and advisors that they get, like me. Really are well-designed, well-functioning programs. And some of the ones that don't currently have those grants are really working hard to get to the point where they can get those grants. So it's a valuable resource for running an MD-PhD programs. Because MD-PhD training programs are very expensive for schools of medicine, because typically all of the students in an MD-PhD program not only receive what's listed here as considerable financial support, but total financial support that covers the stipends that they get paid, so they have money for living expenses, the fees and the tuition and health insurance and so on. In fact, you could say that it covers the total cost of both degrees in not every program, but in most programs, certainly the large programs and the ones that have MSTP funding. And then finally, on the last point on this FAQ about MD-PhD training programs is that MD-PhD programs have been designed since they were first invented 60 plus years ago to integrate medical school and graduate school training. And back in the dark days of the early training programs, things were done pretty much in series, but now that everything is done in parallel. I'll show you that in just a minute. So if you enter an MD-PhD program, you can figure that you're going to get a medical degree and a PhD in a field that's of interest to you, and that you'll be able to complete both degrees in what at the present time nationally averages about 8 years, but ranges anywhere from as little as 6 or 7 to up to 10 or even 11 in occasion. But mostly we try to get students through somewhere between 7 and 9 years of that training, which is less than if you were doing them separately, but it's still a big time commitment. And that's why it's really important that everybody who considers doing this training program recognize what's involved and really be committed to wanting to do it and understand what they'll get out of it. This is my generic cartoon illustrating an MD-PhD curriculum. And so we're going from left to right in about 8 years. You start off entering the program, you go all the way to the right, and you finish the program with 2 doctorates after your name. That's kind of cool. Along the way, typically the first couple of years are spent doing mostly medical school and some graduate school activities. In the middle, years 3 to 6 in this illustration, you do mostly graduate school with some clinical connections to all of that that vary from school to school. We really do want to keep your hand into the clinical part of your training as well during that time. And then once you've finished up graduate school, defended your thesis, and you have a PhD, you go back to finish up in about 1.5 years or so with the remaining requirements for graduating from medical school. And during that time, lots of MD-PhD students, especially those at Penn, dive back into the research setting again. So really, from start to finish, you're in both graduate school and in medical school, but the emphasis on what you're doing time-wise varies a bit over that stretch of years. Now, when you're finished all of that, you're not finished with all of your training any more than you're ready to go out and practice medicine once you've graduated from medical school. And nearly everybody who does an MD-PhD training program does additional clinical training afterwards. Not everybody, but most people do. So that they can eventually have the expertise to be attending physicians, especially if they're going to be in academia, and get a license to practice medicine. In addition, they do additional research training, which forms the basis of their ability to get a job where they get paid lots of money to do the research that interests them, which is kind of neat. All right. Now, I've been talking about MD-PhD programs up to this point, and I just want to briefly point out a couple of things. The first is that there's more than one way to become a physician scientist. Now, you come out of college and eventually you'd like to have a job in the heart as a physician scientist. And one way to do that is through an MD-PhD program, taking about 8 years on average, and then doing residencies and postdocs after that. And then you're able to get a job as a physician scientist. An alternative, and frankly, the dominant way that people used to do it in the past was not to go to graduate school, but instead to go to medical school. And sometimes I talk to undergraduates and they say to me, why don't I just go to medical school and skip all this stuff about graduate school? Won't I get there quicker and get a job quicker? Well, the reality is that medical schools in the United States today do a wonderful job of teaching people how to be clinicians. They're not intended, nor do they accomplish the ability of helping each student learn how to be an investigator, a scientist. And graduate school is what really is intended to do that. And that's the biggest argument for going to graduate school as well as medical school. And in fact, that was really the driving reason why MD-PhD programs were invented back in the 1950s and early 1960s, a long time ago. But if you decide to go to medical school and skip going to graduate school, then what the data of tracking people over the years has shown is that you're much more likely to spend much more time in the postgraduate phase before you get an actual job as a physician scientist than you would if you come out of an MD-PhD program. And so if you look at this graph, the starting point is about the same point, finishing point is about the same point on a time curve. And that's because people who just go to medical school spend more time doing residencies and longer postdocs, learning the skills that are needed to be a successful investigator in the world today. There's a third route too, which some students take, which is not do an MD-PhD program and instead do what I'm calling here MD+, which typically takes at least 5 years and involves a year of full-time research. And there are a number of programs nationwide that allow people to do that. And it's not a bad way to do it. Again, the data show that it doesn't really save you any time. It just gets you about to the same point in your life, at the same point where you're applying for jobs as a physician scientist. And of course, by either of these two routes, the MD+ route and the vanilla MD route, you don't get supported through medical school the way you do if you're in an MD-PhD program. So there really are some compelling financial reasons as well as didactic reasons to do an MD-PhD program if you're sure around the time that you're graduating from college, that being a physician scientist is the coolest, slickest thing you've ever heard of as a career, and that's what you want to do. In the lower right, I've given the reference to an article that I wrote a few years ago that really goes through some of the things that I've been saying up to this point in a bit more detail. And you might want to just screen grab that so that you can look up the article. It's available for free on our website at Penn, but also through the publisher's website. And you can read through in greater detail about some of the things I've had to say. All right, so I'm almost done, but I don't want to finish without spending at least a few minutes to tell you what we look for on the admissions committee, not only at Penn, but at every other MD-PhD program that I have visited and reviewed. So this is going to be pretty generic, and keep that in mind. So there are 4 or 5 things, 5 on this particular list. The first is academic success. And that includes, but isn't limited to, what courses you took, how you challenged yourself, and how well you did in them. So we look at your grades, but we don't reduce all that to a single number, the GPA. We're really looking at your transcripts to see, what you took and how you did in them. And then medical schools still love the MCAT score. So that means that everybody, with some exceptions, but nearly everybody who applies to medical school in the United States, including MD-PhD programs, has to suffer through the medical college admissions test. Maybe I shouldn't say suffer through it, but frankly, preparing for it and taking it and doing well in it is very time consuming. But it becomes an important part of the application process for medical school and for MD-PhD programs. So although nobody thinks that it's a good predictor of who will be a Nobel Prize winning physician scientist, medical school admissions committees still like MCATs. So we're all stuck just as I was. Research experience, really very, very important. Medical schools, if you apply as an MD student, will ask about your research experience, but MD-PhD programs really want to know about your research experience. And that means not only what you did, but understanding what you've done in your research experiences and understanding the bigger picture of how the projects that you've been working on fit within the context of what that particular laboratory or whatever the setting happens to be is working on, and what it all means in the bigger sense. Not just, I came in on Thursday and used a pipette to do, whatever, but really understanding what the project meant and what the results you got mean and how it all fits into something bigger and important. Those kinds of questions regularly come up during admissions interviews. And when I let the panelists start talking in a few minutes, you might want to ask them about their experiences doing research, but also their experiences in applying. Third thing we look for are letters of recommendation. And medical school applications always have a ton of letters of recommendation, and we read all of them. But frankly, the ones that really mean the most are the letters that you get from research mentors that you worked with, either as an undergraduate or as a postbac student. And we hope that they will say good things about you and comment specifically on what you've done and your potential in their eyes to be both a physician and a scientist. Those letters mean a lot. So make sure you get to know the principal investigator or the research team that you're a part of. Make sure they know who you are and make sure they understand what you're going to be applying for and what their role they had to play in helping you get admitted to an MD-PhD program. So that's 3 things. The 4th thing is clinical and service experience. Are you really ready to become a doctor and a team leader? Because team leaders is what we're training physician scientists to be, leading other scientists and staff scientists and graduate students and medical students, and the list goes on and on and on. But you really have to be well prepared to take on the role of being a team leader. So what have you done that shows your leadership skills? Clinical experience is important for anybody who plans to become a physician and apply successfully to medical school. And that includes MD-PhD students. But most MD-PhD program admissions committees are not looking to see that you put in 3,000 hours riding on an EMS truck or doing other things that have to do with clinical experience. Usually, as a bottom line, you want to make sure that you've done enough clinical things in the clinical setting that you're comfortable with the notion of being a doctor, and that you will be happy in your training and in your practice in the future as a clinician. So you got to get used to seeing all the good things and the icky things about being a doctor and spend some time doing that. And finally, we want to make sure that you really are committed to a career as a physician scientist, because otherwise, why would we admit you and why should you go through an MD-PhD program? That's physician scientist training, and it takes a while during the MD-PhD program and afterwards to prepare yourself for that eventual job that you want to get. Are you really committed to doing that? Is that what you want to do? Do you want a career as a clinician where you spend most of your time discovering the new stuff and not just practicing the old stuff that other people have prepared. If that sounds incredibly wonderful to you, as it always has to me, then that's your commitment. And that's a good thing when you're applying to MD-PhD programs. We'll expect you to write about that in your application, why it's meaningful to you. And for sure, when you go for your interviews, we'll ask you, why do you want to do this thing? What does it really mean to you? And we're going to want to hear what your thoughts are. So get used to what a physician scientist career is all about. Talk to people that are doing it. Make sure it's a good fit for you, and be prepared to talk about why it's a good fit for you. So that's 1, 2, 3, 4, 5 bullet points, 5 areas within a review that really is these days holistic at all the programs that I'm familiar with, including Penn's program. And we want to mix all of these pieces together and have it come up with a big green light that says this is a person that we want to meet and that we should admit to our program and spend some time with them as part of our community and helping them on the path to their careers. If you have questions about this that don't get answered today, here's my email address. Please hang on to it. Feel free to email me. Lots of people do that after we give talks like this as part of the outreach process. Here's everybody last week who gathered together for the annual retreat of Penn's MD-PhD program. And I wanted to put up this particular picture to show you that there are real live people who are in MD-PhD programs. And some are short, and some are tall, and some are thin, and some are wide. And they are of all sexes and genders and all groups. And that's what we like, that great diversity. So don't feel that there's no one in the program that looks like you in an MD-PhD program, because there is somebody who looks just like you. And if it sounds appealing to you, to go for it. We are, as far as I know, the largest MD-PhD program in the country at this point, with 222 current students. Plus, we are joined at the hip with a VMD-PhD program. People are becoming veterinarian physician scientists. And so we add all that together, it's a lot of people. Our incoming class this year has 28 new MD-PhD students in it. That's a lot, plus 4 VMD-PhD students, and we've graduated a whole lot of people. So I put up those numbers and I put up these faces just because I want you to get the message that this is not a weird thing to do. This is a wonderful thing to do. All right, having said all that, I'm going to show you this slide for about 12 seconds. And then I'm going to hope that when I stop showing it, all of the panelists who said they'd like to join me today have actually managed to make it through the log-on process. And if so, I'm going to ask them to introduce themselves as soon as I stop sharing my screen. Saya just reminded me that there's a poll that we put up because I was curious as to the folks that attended this, as attendees. So if you take a moment, you can answer it. We won't know anything about you in that process, but I'm curious to see how many of you are still in college and how many of you have already decided that you're definitely or just thinking about applying to MD-PhD programs. All right, let me hop out of this. And Saya, have I successfully stopped sharing?
Yes, you have.
Okay. And it looks like my panelists are here, which is good. At least most of them. I'm not sure I'm seeing everybody at the same time. So is it possible to have all the panelists turn on their cameras so we can see their faces? Jonathan, thank you for being the first. Nina, Jacob, Margaret, Maggie, Michael, Dion. Looks good. All right. And Nina smiling as always. Panelists, would you like to turn on your microphones and I'll let you introduce yourselves. Jacob, since you are the elder statesman in this group, would you like to go first and tell everybody, where you are in the program and what you got your PhD in?
Yeah, so my name is Jacob. I am, as Skip mentioned, the oldest person in the program here. So I'm currently in the final year of my MD-PhD. My PhD was in neuroscience, and initially I was planning to pursue a neuroscience or directly neuroscience related clinical specialty as well. Ultimately ended up shifting to internal medicine and now thinking cardiology. Currently applying 2 internal medicine residencies in this current application cycle. So like those of you who are currently applying to MD-PhD programs, I share your pain of going through the application process one more time. Unfortunately, this career path that we're on has many opportunities for additional applications along the way. So as you'll discover.
Thanks, Jacob. Good introduction, and I appreciate you doing this. And I'm sure the brain must be connected to the heart in some way. Michael, would you like to go next?
Yeah, definitely. Before I say anything, I think Hope wanted us to tell you to turn on camera, I think. Skip, I'm not
Turn
sure.
on my camera? You mean it's not
Yeah,
on?
because we can't see you right now. I'm not sure.
How's
Okay.
that? There I am. Okay. Appreciate it.
Yep. But yeah, hi everyone. I'm Michael. I'm on the other end. So I just finished on my first year, entering second year in Penn's MD-PhD program. I'm in the bioengineering department, and my research kind of focuses on like computational MRI, stuff like that. So yeah.
Thanks. Nina, would you like to go next?
Yeah. Hi, everyone. I'm Nina. I'm I guess, fourth year now in the program. I'm in my graduate school phase in the Capella Lab, and I'm studying the epigenetics of squamous cell carcinoma. And I look forward to answering all of y'all's questions about the program.
Sounds good. Maggie, would you like to go next?
Yeah, hi everyone. I'm Maggie. I am, like Nina, starting my fourth year in the program. So that means I'm starting my second year of PhD training. Also in the bioengineering sort of world, focusing on tendon biomechanics and biology, hoping to one day be a sports medicine physician scientist.
Thanks. Jonathan.
Hey, I'm Jonathan. I'm just finished my second year in the program, just finished step one, now about to start official PhD phase. I'm in the genomics and computational biology graduate group. My main interests are in cancer biology and neuroscience as well.
And Jonathan, at some point, if you like, you can put in a plug for your book, the Bible of applying to MD-PhD programs.
Oh, thank you, Skip. I would love to. Along with a couple other MD-PhD friends, I had published the one and only official guide to applying to MD-PhD programs specifically. And I've gotten some really awesome feedback from it. And of course, Skip wrote the very best forward for it that one could write. I'll put a link to it in the chat, and hopefully it can help some of you, and even better, increase that interested and confident level on that poll that you just put out.
Thanks, Jonathan. It is a good book, despite the introduction. Dion, would you like to go next?
Yes, I apologize though. I had technical difficulties and got kicked off the Zoom call twice, and then my Zoom background was like this, so I missed what the prompt was.
The prompt is introduce yourself, say how far along in the program you are, and anything else that you think is appropriate by way of introduction, as you've done before.
Got it. My name is Dion. I'm just entering my fourth year of the program. So that means I did the first 2 years of med school and 1 year of PhD, and now just continuing on. I'm in the chemistry department, and yeah, other things. Originally from Los Angeles, went straight through from undergrad to here, went to Yale for undergrad, and that's mostly it.
Perfect. I think that's everybody. And I see, according to my screen, that there are 100 attendees in addition to all of us on the panel. So that's great. And it looks like there are things in the chat and things in the Q&A. So let's see what's going on. Saya, is it best the way you have things set up to read the questions out of the Q&A, or should we let people raise their hands and ask a question?
I can go ahead and read the questions out of the Q&A if you want me to.
Okay, give it a try.
Perfect. All right. Yeah, we'll start the Q&A section now. If you have any questions specific to any of the panelists, just write their name in the question and I'll tell it directly to them, and make sure to upvote the questions because I'll be reading them based on which ones have the most upvotes. So first up, we have, what are the job opportunities available after done with an MD-PhD training program?
Got it. Jacob, you want to start that off? Since I'm sure.
Yeah. So there's a couple options. I would say I'll start off. I'll maybe go most common to least common, and I think Dr. Brass's pie chart gives you a sense of where I'm going with this from his presentation. But most common is that after finishing an MD-PhD, you go on to do a residency in a medical specialty, followed by some form, likely of fellowship training, a little bit of additional research training, and then you'll start your career as an independent investigator in an academic medical center. Some people at various steps along that pathway decide that maybe academia is not the right fit for them. And I would say a minority end up actually shifting away from academia towards industry and end up pursuing research in the industry setting as opposed to academia. Alternatively, there are people who decide after completing an MD-PhD that they actually don't want to practice medicine and would prefer to be full-time research scientists. And so rather than pursuing a residency at all, they end up going directly into a postdoc or a postdoctoral fellowship after their PhD or after their MD-PhD. And that just provides them some additional research training. There are also people who go into consulting. Again, this is a very small minority, but people who go into consulting, go into finance, go into venture capital, private equity. And I think one of the benefits, just to briefly plug our own institution, one of the benefits of Penn is that being such a large program, if you have interest in any of these, less common paths in the MD-PhD life cycle, there's odds are strong that there's someone who's graduated from the program who's previously followed that path. So I've spoken to alumni who ended up in private equity, alumni who ended up being full-time research faculty, as well as alumni doing, the more common option of being an academic physician scientist, doing a mixture of both seeing patients and performing independent research.
Good answer. And I think that really covers it. The reality is that you get enormously generalizable training when you go through an MD-PhD program, and the options of what you can do are really good. And Jacob already mentioned some of them, and you saw them in the pie chart as well. What that doesn't give a sense of, though, is the job market. And so maybe I can try to address that a bit too. The number of people that are on path to become physician scientists is not huge. You look at a program like Penn's and you think that there's just a ton of MD-PhD students around the country, but the reality is that there aren't. There are about 500 people who graduate from MD-PhD programs each year. And that's only a fraction of what the job market is looking for, both in academic and non-academic settings. So we keep close tabs of our graduates from Penn's program, and they're all doing wonderful, meaningful things, and nobody is driving an Uber that I've discovered so far. Not that that can't be an okay career path, it's just that you're kind of overqualified for it if you have a couple of doctorates. All right. So you want to pick another question that had lots of people. Here's one. Actually, let me pick this one because 10 people thought it was a really good question. And I'll let the panelists answer this one. How many hours do you spend studying and working per week? And I assume they're asking in the MD-PhD program as opposed to, before you got there. Somebody want to go first on that? Who's nodding vigorously? Nina, you want to start? I saw you nod.
Sure. Yeah, I think the answer kind of varies depending on what stage of the program you're in. So I think for us here at Penn, we do our first 2 years preclinical and a little bit of clinical training as well. And so in the preclinical side of things, you have classes, so you're mostly studying for those classes almost every single day, and you're taking classes in the morning and studying in the afternoon. I can probably talk a little bit more about the graduate school phase because that's what I'm in now, and I have a better memory of exactly how many hours I spend per week. I would say I try to do a very typical 9 to 5. Graduate school is really nice because it's incredibly flexible and you set your own hours. Some of my lab mates come in at noon and leave at 7 p.m. Some days I only come in and only have a couple hours worth of work, and other days I come in and have about 10 hours worth of work. But I would say in general, a lot of the program, you set your own pace and you decide how much you want to study or how much you want to do experiment-wise when you're in the grad school phase and so on and so forth.
Thanks. Michael, since the beginning phase of the program is fresh in your mind, you want to talk about how many thousands of hours you spend per week studying?
Yeah, I'd probably actually be on the opposite end. I don't think I study enough, frankly, but I think one of the really nice parts that it'd be nice to like look for in programs when you're applying is whether or not they're pass-fail for the preclinical stuff, because Penn is, pass-fail, and so it takes a lot of like the stress of like trying to like compete with your like classmates and stuff, like kind of off your back, and you're able to like collaborate more with people. We have like team exams and stuff like that, at least a portion of it, and so that makes things a lot easier, and you can really just focus on like learning the salient parts that you really want to focus on. So it's really a lot less than undergrad, if that gives you guys a sense. So.
My gosh, I'm not sure I want to hear this. It's okay though. Jacob, so can you talk specifically about the time commitments and requirements for clinical settings when you're doing both clerkships and electives?
Yeah, so I would say probably the most time-intensive period of your training is the clinical phases. Because there's a lot to do and it's a hospital system and there's actual patients as opposed to mice whose lives are depending on you. And then on the flip side of that, it's also the time when you're out of control of your schedule. So you're not setting your hours. You're being told when to come in based on when the team is rounding, when the attending shows up, when the residents show up. So I would say during clerkship, it's quite a few hours. It's more than I care to admit. The expectation is that you're there basically when the team is there, and oftentimes they'll send you home a little bit earlier than they leave, so a couple hours earlier. I would say, as a clerkship student, it varies wildly, but most of the time you're working probably anywhere from like anywhere around a 60-ish hour week. And my panelists can feel free to correct me if they've had a very different experience, but I would say around 60-ish hours a week. As a sub-intern, which is the kind of next step up as a student after your clerkships, you spend significantly more time. And so that gets closer to 70 to 80 hours a week. However, at Penn, the rotation that I was on was also, you stayed over at the hospital for a 28-hour call. So that really jumps the numbers up pretty quickly if you're sleeping at the hospital. And then in terms of electives and other medical rotations, again, highly variable. In general, surgery rotations tend to be the most time intensive. Medicine rotations tend to be a little bit more relaxed. On the inpatient side, they're slightly worse than on the outpatient side. All that is to say, the experience that you have as an MD-PhD is going to be wildly variable. You'll go from being a preclinical medical student focusing on lectures and doing maybe a little bit of lab work to a clinical student who's spending a ton of time just in the hospital. And then you'll jump back into the PhD world and you'll be doing research full time. You'll be in total control of your schedule. And then ultimately you come back to medical school. Again, you're a medical student again, you're at the whims of someone else's schedule. And then you end up, eventually in your final year of your MD PhD, maybe as I do, having a little bit more control over your schedule. But it's, every year is totally different from the one that preceded it.
Yeah, thanks, Jacob, and thanks each of you. I guess the answer is it varies a lot depending upon where you are in the flow of the program, and what the demands are in terms of studying to be able to pass all the tests that have a way of popping up frequently. I think it was Michael who made the point about Penn being pass-fail, and that's something that didn't exist until relatively recently at medical schools around the country, but it's become a more and more popular option for medical schools to do that. And I think the plus side of that is that it takes some of the stress off. Preparing yourself to apply to medical school is stressful, so it's nice that if you get into medical school and you're moving ahead as either an MD or an MD PhD student, that the schools are trying to decompress some of the stress. Because you're doing stuff that you like to do, and it's nice to not have the added stress of doing it while you're doing it. There's another question on here that was really popular, and here it is. Okay, so this will be especially for those of you who are relatively early in the program and therefore remember what it was like when you were an undergraduate. I had said when I was going through the slides something about getting clinical experience. I think some of the folks who are attending this would like to hear some examples of the kinds of clinical experiences you did prior to applying to an MD-PhD program, just to get an idea of, how many hours you might have put in on it and the kinds of things that you might have done. So Jonathan, would you be willing to start that off, and then maybe one or two other people could add in their own experiences?
Of course. And for everyone listening, you'd be hard pressed to, get programs to tell you a particular number of hours, because it really is just about building up a breadth of experience and competency in basic level of understanding how a clinical environment works and being able to determine if that's something you're going to want to pursue. However, you can flip the question around and say, how many hours does it take to generate that level of understanding and competency? So I generally recommend to people about 60 to 100 hours of shadowing, quality shadowing across a couple of specialties, with a number of different physicians who are willing to teach you a few things, as opposed to just standing for 100 hours in an operation not knowing what's going on. And as far as volunteering goes, a couple hundred hours, 100 to 200 hours, across one or two different types of settings, hospital, clinic. A lot of people recently have volunteered in vaccine clinics. Undergrad that I know who have advised their applications, seems to be a popular thing. All of these things allow you to see how a clinical environment works, allow you to determine if interacting with patients and participating in that environment is something that you're going to want to do. And moreover, that's enough time to be able to give you some, more profound experiences that you can talk about on essays and on interviews, which is really, I think, the bottom line when it comes to most of those activities. So having 3,000 hours of shadowing really there's a point of no return where that's no longer useful. And in fact, I advise often against doing excessive numbers of hours of clinical experience during undergraduate, because that's really taking away time from research and other things where you can actually be productive as an undergraduate student, whereas undergraduate volunteer or shadowing isn't really a productive use of time in the clinical system.
Well, especially for somebody who's applying for a research-focused career training program like an MD-PhD program. And I agree with you that, in the admissions committees, we'd much rather see lots and lots of research time than lots and lots of clinical experience time. Maggie, would you be willing to say a bit about your own clinical exposures? Because if I recall from your application, you did some interesting things.
Yeah. I guess I'll just tag on to, what was just said as well of, the key here is not hitting a number of hours. The key here is having meaningful experiences. And so for me, like part of my sort of like senior design in college was very well integrated with the clinical environment. So it was nice, kind of like a 2-for-1. I was getting to hang out in the ICU and do sort of like some of my classwork while also kind of like double tagging and getting in the clinical exposure as well. So I just think, again, not to sound like a broken record, but rather than saying like, I shadowed X doctor for so many hours, like find something that you are genuinely engaged in, that brings you joy, that you're having meaningful experiences, and do it as much as it continues to be a meaningful experience, and that will shine through on your application.
Thanks. Michael, you were probably, I suspect, trying to get clinical experiences in the middle of the pandemic.
Yeah, that was challenging.
And how did that work out? Did you find ways to do it despite the pandemic, or did you end up with not much time in the clinical setting?
I think I did most of my clinical experiences, at least I started them prior to the pandemic, so that was kind of nice. Research definitely took a bigger hit for sure, because I was, to give some context, I was finishing up undergrad when the pandemic first started. And so, it involved taking a lot of adjustments. But that being said, still, I just want to second what everyone else has already said on this. Really, the goal is to shoot for generally what I tell people is 2 to 3 very meaningful, experiences where either you transformed, the patient's care or the patient interaction somehow transformed your understanding of medicine. And I would just add on that like at least the things I chose to focus on, they were specifically geared for like applying for MD-PhD programs. So for example, I got the opportunity to shadow like physician scientists specifically, and I was able to see like how they were able to translate, basic sciences and things like that into like an actual clinical practice. And also on the volunteering side, being able to actually work with the technology that we were using in my lab and being able to take it to like a resource limited country and being able to implement it in like a real life clinical scenario. So those things were like, I think, very relevant. I understand that not everyone gets the opportunity, but if you do have a chance to get things that are like meaningful, specifically for, your path as a physician scientist, I think that's always very helpful.
Great, thanks. Let's see. I'm going to read a question that I think I'm probably the best one to answer. How common is it to get a PhD in a discipline that is not related to medicine in an MD-PhD program? I guess you'd have to ask me, whoever wrote that question, what particular area you have in mind. The majority of students in MD-PhD programs across the country are doing the PhD in a traditional biomedical PhD discipline. And then there are a bunch of people who are doing biomedical engineering, and there are people who are doing PhDs in a variety of different social sciences. But the numbers of people that are doing social science PhDs is smaller than the number of people who are doing biomedical engineering. The number of people in biomedical engineering is smaller than the number in traditional biomedical areas. So my advice is to go to the AAMC's website in the part that has information about applying to MD-PhD programs. And there you'll find among the listing information for various MD-PhD programs, a table that shows which PhD disciplines they are currently, or at the time the data were collected, affiliated with. And that'll give you a sense of whether something that you're interested in doing has been offered at different places. But not every program will offer PhDs in biomedical sciences. And then some programs will do some of the others, and you just have to look around, again, depending upon the area that you had in mind when you asked that question. Let's see. There was a great question on here, which was something along the lines of, how scared were you at the thought of a training program that lasts as long as an MD-PhD program does? And did it terrify you out of doing it? Well, clearly it didn't. So somehow you must have overcome that fear. Would any of the panelists like to talk about that? Maggie, you're smiling behind your hand and nodding vigorously. So
yeah.
Talk about your terrors.
I mean, 8 years is a long time. There's no getting around that. I think when you talk to physician scientists who, like, they knew this was the right choice for them, they can tell you without a doubt this is the best career in the world and it was the best decision they've ever made. And so those people gave me a lot of confidence that it was the right thing to do. I do think we chat about this a lot, that especially for women, the timing can be really challenging. Like if, for example, you wanted to start a family or things like that. But I always try to remind people that you're going to be 30 or 35 or whatever age you graduate your MD PhD at regardless. So if you feel like this is the path for you because you genuinely want to do both clinical medicine and research of some sort, go for it. Find a good program that's going to support you in your unique path and whatever comes up in your 20s, 30s. But it's an awesome career. And so if you have the opportunity to do it, don't be afraid of that.
Great. Thank you. Anybody else like to address that same issue? Okay, so maybe Maggie's perspective, or Maggie, your advice was wonderful, but maybe your perspective matches with everybody else. All right, there's a question in the Q&A, which I think is a good one to bring up, which is the question about taking gaps between college and entering an MD-PhD program. And I know that some of you did and some of you did not. Who did not? Michael?
I didn't.
Okay. Michael, was that you talking just now? Sorry. Or did somebody else say I did not?
I think that might have been me, Skip.
Ah, okay. I was looking in the wrong direction. You want to talk about that decision, and then maybe somebody who took a gap could talk about it as well?
Yeah, and I know we're also running up on time here.
Yeah.
They want to end at 2:50. Or
We can have
3:50
this
on
be the
your-
last question. So go ahead and answer it, and then we'll end after this one.
Great. So what I would say is I ended up I was a Penn undergrad, went straight through, did not take any gap years, and matriculated directly to the medical school across the street, and then started my MD-PhD. I would say that is common, and I would also say it's also common to see people who take time out. I have many friends who took multiple gap years, 1, 2, or 3 gap years, often at the NIH doing their post-bac program in research full-time. Brief plug for that, because it certainly does seem to be a good pipeline into the MD-PhD world. But what I would say, and I mentioned this, I answered one of the questions just typing in the Q&A, was I think the really critical thing is to decide, do I want to devote a career? Do I want to devote my time, effort, a lot of effort to a career in research? Because a lot of people, I think, come at this from the MD perspective. They're already planning to apply to medical school. And then the question is, do I do an MD PhD? And if at the end of your undergrad, you're unsure and you say, you know what, really, it's a toss-up. I have a lot of friends who said, really, it's a toss-up. I'm going to go do research full-time at the NIH. And that's going to help me decide whether or not to pursue an MD PhD. That being said, I honestly came out of my undergrad. I remember I was a sophomore. I was working for an MD PhD in the lab, and I was like, this is incredibly cool. He's who I want to be. I want to do that. And so the answer for me was pretty straightforward. I was going to apply MD PhD no matter what. And so I applied straight out of undergrad. I think at the end of the day, the timing is incredibly personal. It's got to kind of align with your overall plan. You know, what courses do you need to take before you take the MCAT, before you can apply? You know, do you have a good research experience that you can write about, that you can talk about with a mentor who's going to write you a letter? There's a million different factors that come into play in terms of the timing. But I would say I don't think there's any wrong choices. You can go straight through, you can take time out. And Skip can correct me, but I've heard him say before that it's not a detriment to your application to apply straight through. So if you feel confident and you feel like I've really got a good application, I feel like I've thought about this decision really well and I'm ready to go, I don't think there's any downside to going straight through.
Yeah, thanks, Jacob. That's a wonderful answer. So do we have another minute or so, and I'll toss in a thought about that question as well? Or do we need to shut it off?
Yeah,
Okay.
you can quickly answer it.
So this is an important issue. The national data show that 3/4 of entering MD-PhD students the last few years have spent 1 or more years in a gap between college and entering the MD-PhD program. So I don't know that that's necessary for everybody to do it, but these days a lot of people do it. And if you'd like to look at those data and hear the reasons people gave in the survey that we ran for doing it, just Google my name. It was an article that was in JCI Insight. It was published earlier this year, and it goes through that entire issue and will give you a sense of, as you try to make that decision, you know, how other people made that decision when they were at a comparable point. And with that, if we're out of time, I'm going to thank all the panelists for taking time out of their busy days to join in and to share their experiences. I think that was wonderful. And my screen says that we've had about 100 people attend this over and above the panelists. I think that's great. Good luck to all of you. I'm sorry we didn't get a chance to answer everybody's questions, but we did hit a lot of them. And I posted my email address, and you're welcome to email me if there's something that I can specifically help you with. And with that note, Saya, I'm going to turn it back over to you.
Yes, thank you so much, everyone. Thank you, Dr. Brass, for your presentation on dual degrees. It was so informative. I learned so much, especially as someone who is interested in pursuing a dual degree. And thank you so much to the panelists for answering all the questions. I think everyone definitely learned a lot, and we are so appreciative for taking time out of your busy lives to help us out. Next up, we have another speaker, Dr. Emily Anhalt, who is covering questions about her career as a psychologist, and she's also the co-founder of COA. So please head on over there to hear her speak. Thank you so much for attending.
And Saya, I'd love the answers that came in on that survey. If you can pass them along to me at some point, that'll be great.
I will be sure to do that.
All right. Okay, take care, everybody.
Have a good day, everybody.